Well, I thought I was going to have afternoon tea to prepare a bit of a summary of key themes, but I'm just going to kind of run with this and talk off the top of my head. So I was asked to pull together a summary of themes, which is quite a daunting task in some ways for conversation that's roamed really widely. And there's a lot of complexity in these issues. I wanted to say, so first of all, Rick Williment, I was had the privilege of being engaged by the Ministry of Health to set up the exemplar services. So I was involved in service design and procurement and going through all of that, helping get the advisory group and designing the evaluation and all of that. So real privilege to be involved and exciting to be involved with that. I wanted to reflect that in 1996 I was a planner and funder for the Central region. I had the addiction portfolio and a $9 million budget for the whole of the Central region, which was a pittance really. And there was nothing happening around youth AOD. I think we had funding for like a handful of FTEs in the whole region. And a group of us, Ian McEwen and Kate Cosgriff and a few others, Basha Arnold from the ministry, had a hui. We went away for 2 days together to think about what on earth are we going to do. And I remember one creative solution was, send all our young people to an island until they grow up and they're old enough and can manage. And it seems kind of humorous, but actually sad. Because we did not have an infrastructure where there was no strategy, there was no money, and there was little interest. So it's really heartening to have been here with the forum in Parliament last year that Peter Dunn opened, and to see the groundswell, and feels like we've come on another step with this forum. With clear models of care being talked about and some of the finer issues being debated, and in a really good way. Anyway, I won't keep you. I will. So what I did in the last 5 minutes was just flicked through some of the notes. I've been keeping notes throughout the day and just highlighted some of the things that occurred to me as being key. And some of those are probably a summary of the discussion. Some of them are likely to be my own ideas. I was really taken in the exemplar service design process with the notion that the prevalence of youth AOD is enormous. And I don't mean to be pessimistic, but it looks likely to continue. And we've got a tiny specialist pool of resource and a growing specialist pool, which is fantastic. But providing treatment as usual is not really going to cut it. And the exemplar service specs really imply a different role for the specialist. And, I think some of that's coming into the discussion today around how to work effectively with people that are engaging with youth in other settings, whether they're youth justice or education settings or in youth one-stop shops. And I think it's quite a significant implication. And I don't think we're quite there with that yet. Feels like we're at the point of developing the expertise and the know-how. But if I wonder about this for 5-10 years' time down the track, I think I would be heartened to see specialists working really creatively in that kind of consult liaison training, mentoring, supervision type activity, supporting youth workers to engage with young people effectively around their AODs and mental health and housing and etc. So that's probably more of a personal reflection, but loved Sue's. So what I'm just going to do is pull out some highlights for me, and then I'll I'll leave the podium. Interwoven into one garment. Loved it. Youth need this. As a parent of teenagers, I completely get that. Not just chronological age, but developmental age. And I think the whole gap in our service at a policy level around youth being to age 19, flexibility to age 20 or so, is a nonsense, if I can say it so frankly. I think these youth services being mobile and engagement focused and youth friendly are in a much better position to respond to young adults, and working alongside youth one-stop shop type services, you know, which have a 23, 24 year age range. It just makes so much sense. So will we be saying that in 5 years' time and repeating that? You know, it's like, where does the responsibility for that debate sit? It's probably at a ministry level, but anyway, the exemplar services are flexible around that, so that was heartening. Youth driven from the start. Kelly, thank you for that. Get young people on board, and LJ, get young people on board before the plans are laid. Involve young people in meaningful ways. We've been saying that for a little while. And, you know, pragmatic. How do you do better liaison with primary care when, you know, if those of us that have been involved in mental health service improvement, you try to engage with GPs and you either do it at lunchtime when they're having a sandwich or you pay them, their businesses, you know. And how do we do liaison with a sector that's incredibly busy and have a million priorities? So I really liked that, Sue, thank you. Work with the willing, low-hanging fruit, if you like. Though, you know, ask young people who's friendly, get to know them, build a reputation with that group. Addressing CEP, the range of complexities, again, not just mental health and AOD, the whole person. And the heads training is great, that the Wary Centre are leading around that. And I really loved, what does a good service feel like? Not what does it look like, getting beyond what things look like. And it might feel welcoming and hopeful and capable of responding to complexity. And leadership. So when I look around the room, I see many people that have been around for a long time. There's real commitment, real leadership, and that's fantastic. So, thank you.
Kia ora tātou. My name's Philip Grady. I'm the co-chair of NCAT. And Vanessa, I'll get you to put your hand up to show the other co-chair of NCAT. Thank you. And all you need to know about NCAT is in the flyer. Look, if you think about the things we've talked about today, collaboration has been a big point, change has been a big point, and celebrating success. Two things about me. One is my parents drove into me from a very early age is that you actually don't talk about your successes much. The other thing is that as much as many people say that they really like change, I can't stand it. I'm 43 years old. This morning I had to get up at, I don't look 43. I know you're all thinking that in your head at the end of the day. This is a much younger man. I had to... You laughed too early there, Gerard. Too early. I had to get up at 4:15. It wasn't a terrifying day, but it was a bit of a change for me. Rushed to the airport before I had my breakfast and my usual cup of green tea, hop on a plane, come to a different place. The terrifying part was we came into land and the pilot said there was too much wind shear. Didn't tell us that until we had taken off and gone around again, and that was a little bit terrifying. But it was a bit of an upset to my routine. I then we went across the road for a coffee. This is not a long story, and I saw Deb Fraser in the same cafe, and we had I suppose, an opportunistic conversation around some of the challenges that we both face in terms of the services that we were delivering. And Deb said, look, this is the approach that we are taking. And she produced a couple of wee absolute gems about how she is bringing on new staff, new youth practitioners into her services and preparing them even before they're appointed into a role and for before orientation to the type of service and where they're going to be working. If you think about my experience with change, although it's probably slightly flippant around this morning, if you think about a clinician that's actually working on the ground in any one of our services and the prospect of having to do something different tomorrow or the next day or the next day is something significant. If you think about us as managers and leaders, the prospect of having to do something different or lead something different is not without its challenges personally. And I guess that, one of the take-home messages, I asked you to think about on your way home is around what does change mean for you personally? LJ both LJ and Kelly made some really important comments. And LJ, I was taken by your comment around actually we've had some of these discussions across a long period of time, and I don't think necessarily that we've actually bedded down some of the changes. I think we've gone some way, but I think there's a long way to go. Look, in terms of, I just want to do some acknowledgements on behalf of both NCAT, the Ministry of Health. Gerard, I just want to acknowledge your contribution in terms of pulling together today. I want to acknowledge the New Zealand Drug Foundation for all the coordination of today. Particularly acknowledge Kelly and LJ, you brought a lot to the day, and Sue, you also brought a lot to the day for me personally in terms of your thoughts, both in the session and the group. And also for every single one of you that has contributed. I also want to acknowledge Peter, and it's a bit of a shame that Peter's not here, because I think Peter's been quite brave and from a ministry's perspective in terms of the approach that he's taken with the exemplars. We're living in an environment where actually it's easier to do nothing. It's far easier to sit on your hands and do nothing, and I think Peter's been quite a wizard in terms of, a Gandalf the Grey way, in terms of creating an environment that actually is starting to have some service change, bringing the providers that are leading out that change, bringing together the exemplar advisory group, and bringing together us as providers and interest in the sector to actually start to have a discussion around where is this going and what might this look like in the future. Peter might be a Gandalf the White now, depending on whatever he was dealing with when he went back to work, but I just think it's important to acknowledge Peter. I think he's been very bold and very brave. Look, in terms of the next steps, the where to from here, youth AOD services is a priority for NCAT as part of a range of priorities. The first initiative was the parliamentary event in Wellington that some of you came and participated in. This was the second event. The next two action points are, and we've been working with the Mental Health Commission in terms of Grant and Lynn, where there will be, as Rick talked about and others have talked around, a summary document of the key outcomes from today, which will be published and so be then available in a cohesive, coherent way to inform the discussions that you're having back in your services and the discussions that you're having back in your district health boards and the discussions in the wider context of youth in the sector. The other activity from today is that there's a small group of people that have been tasked with developing a vision for youth in 2020. And that's aimed to be equally a published document that really starts to have us lift our horizon to where we want to be in the next 5 years, which is actually not too far away, but it aims to be provocative and it aims to keep the discussion going, because it's an important discussion and we actually need to start to turn it into action. So look, finally, just in closing, on behalf of NCAT, on behalf of the Ministry of Health and Peter, I want to thank you all so much for your contribution today. You have contributed in a number of ways, both in the groups and a lot in the side discussions, which are often not seen as important, but I think are some of the critical places where good things happen. So thank you all, and travel well.